The experience of having COVID is obviously incredibly dangerous. I mean, we are rapidly racing towards 1 million dead just here in America confirmed from COVID. But we also know that surviving COVID doesn't mean that you are totally out of danger. There's the experience of things like long COVID, which we are learning more about and how terribly debilitating it can be. But also the odds that you might be more likely to experience other negative health outcomes as a result of your previous COVID infections. So new study we're gonna look at specifically things like heart problems. Your risk after having COVID go up for at least 1 year following your infection. We have this study published in Nature magazine that found that COVID increased the possibility of heart rhythm irregularities as well as potentially deadly blood clots in the legs and lungs in the year after an acute infection. COVID also increased the risk for heart failure by 72%, heart attack by 63%, and stroke by 52%. Even among those whose original illnesses were mild. Now, understand what those numbers mean. That doesn't mean that you have a 63% chance of a heart attack or anything like that. They are relatively small chances that then become marginally larger as a result of this. But when you have a country where a significant portion of the entire country has had this infection, that could result in a lot of additional heart attacks and things like that, Francesca.
Yeah, it's frightening. I mean, I think the cardiovascular impact and effect of COVID-19 is something that has still remained largely unstudied. At least we don't have that. Like, why? Why does it do this to your circulation and affect your heart the way that it does? It's terrifying. And this study I know was particularly focused on people who had not yet been vaccinated. And I think that it just goes to show, get vaccinated. Get boosted. And I am curious and eager for the study, the same study for people who have been vaccinated, because I assume that they're not completely out of the woods. Even if there is a small, like let's say a 15% increase of chance of some sort of heart event in the year after you get COVID, like that's not good. I wouldn't wish that upon anyone, and I don't want that for myself or anybody I love. So, protect yourselves, you guys. I know that mask mandates are dropping, but we have to do what we can to, at least when you're indoors, just try to protect yourselves.
Exactly, yeah, I know, like everybody just every day somebody yells at you, it's over, we're done, we're moving on. Okay, well, they might be done, they might be moving on, but maybe COVID's not moving on inside of your system. Yeah, this stuff can be serious. And you identified the biggest issue right now is that so far, they don't have a breakdown of how levels of vaccination affect this. They just don't know that. They do say that the level of severity matters in some ways, but not in others. So if you had an acute infection, it does seem like it's worse. If you were vaccinated, you're far less likely to have had an acute infection. But they also say that even mild infections can cause problems. Now, how much of this data includes people who had Omicron? Is it possible that Omicron will be different? All I'm saying is we don't know for sure, but we do know that the people who have been like just racing to get infected so that we can have herd immunity or whatever, like we said at the time, how many videos do we do? We don't know the consequences of that, not just in terms of death from the people who are choosing this, but the long-term implications, and it is true. And the little that we do know is pretty scary. So for instance, the researchers who looked into this, they thought, okay, we're gonna look at this and we're gonna find the trends, but there's certain expectations we have, which is people who are already really sick, they're probably gonna be badly affected by having COVID, those sorts of things. But they found instead that it affects pretty much everyone. So one of the doctors says, it was a bit of a moment for us when we realized it was evident in all of these subgroups: younger adults, older adults, black people, white people, people with obesity, and those without. The risk was everywhere. And so just be serious. And honestly, like I see people talking about Joe Rogan in the chat. Like one of the things where Joe Rogan got media attention like a month ago was when he brought in a guy and he said casually to him that being vaccinated means that you have a much higher chance of getting heart problems. And the doctor that was on was like, no, actually having COVID is much more likely to cause problems. That's just one part of this. So is he good? He's got this new commitment to giving accurate COVID information. Is he gonna bring on one of these doctors? Maybe he will. I'm sure he could if he wanted to. And they could explain how negative this would be. And by the way, remember, they said young people. So when people like him go and say, there's no reason for a healthy young person to get the vaccine, well, maybe there's a reason. Maybe this is identifying a reason.
Have him on, you coward. Talk to 11 million people responsibly. Yeah,
And
it's
Fox News
great.
gonna
I'm
cover
glad
this?
we have, in a world where everything's so opaque, I'm glad we have this study. It's scary to me, but every single new piece of data that gives us more understanding of this virus, I think is important. We should be talking about it. This was a robust study. These are thousands and thousands of people who they monitored, and they compared, and the sort of the control groups, and all the other science things. I'm sure beakers were involved. They did their own research, and so let's talk about it.
Yeah.
Are you gonna do the same amount of research to prove the opposite? My guess is no.
Yeah. By the way, I just want to go over some of what has previously been described. So there was a study of recovered COVID patients in Germany. They found 78% of patients had heart abnormalities. Swedish researchers found an increased risk of heart attack and stroke. Let's see, an international study released last year identified more than 200 symptoms of long COVID, from hallucinations, tremors, tinnitus. Geez, and by the way, the fatigue, which there's been a lot of great threads on Twitter about, like when you hear that long COVID causes fatigue, you think, oh, you have a little bit of fatigue. But like, I'm blanking on his name now, but there is a journalist for the Washington Post who says, like, I was conscious and moving about for 15 minutes yesterday. Like, it is incredibly debilitating fatigue. And these are the sorts of things that get swept under the rug in the rush to go back to normal. Just accept all this, go get sick so we can move on. First of all, you can get COVID again, so it's not even the shield that they pretend that it is, but the cost can be just devastating. Anyway, by the way, here's one other little thought experiment going forward. So we already know, and we acknowledged when I said that close to 1 million people have died, that those are the official deaths. So if in the early months of this, you weren't tested because we didn't have tests and you died, you didn't get counted. Here's a fun little thought experiment. If in 2 years, we have 1,000 heart attacks, and it was 20% more likely if you had COVID, and some of those people die, how many of those died not from COVID, but not from COVID? Like, they had heart attacks, they had all these problems, they will have died. Will they be counted? Of course they're not. We'll never know. We will never know how much actual death and suffering was caused by this, because there's so much that just necessarily hides it.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.